Well, good morning, everyone, fellow Rotarians, guests. Good to be here with you. And we're going to give an update on the pandemic. And here's the virus, as you know it, artist's portrayal that was put together for the CDC. And it shows some of the important parts of the virus, particularly things that are on its cell surface that could be targeted by antibodies and other therapies, particularly the S protein, which is this bit of the virus there. It's like a nail sitting on top of the virus. The virus is officially called the SARS-CoV-2 virus. It causes the disease COVID-19 in humans. Please take it very seriously. Prevention is simple. Follow all the precautionary measures, stay at home as much as possible, and don't take any medications or supplements other than your daily meds. Yesterday, I had a virtual consultation from a patient who's taking about 6 different vitamins and supplements, and also carbon tablets. And the carbon, of course, impedes the absorption of the vitamins. So that means that she's not taking anything at all except carbon. You have to be careful. Some medicines counteract each other. Some medicines, when put together, become toxic. Take only those things that are prescribed by your doctor. Distance, social distancing is important. 6 feet is the recommended distance here in the US because it's a nice round number, 6 feet, that anyone can remember. It is the minimum recommended. Actually, in Europe, they say 1 or 2 meters. So things different between the US and Europe because of our different ways of measuring. And remember, the virus infects a person but doesn't necessarily cause symptoms. In fact, 20 to 40% of those who test positive are asymptomatic but contagious. You meet someone while walking outdoors, you have no way of knowing if they're positive, if they're infective, if they're contagious, just by their appearance. They can have no symptoms and be contagious. So wear a mask. Whenever you go out of your home, wear a mask. Wearing a mask helps you with that. Coughing is bad. Sneezing is even worse. The droplets, the aerosol caused by coughing or sneezing goes far, but with sneezing, it's even stronger and it goes farther. And here's John. I have shown you John before. John coughs or sneezes, and if it's a cough, it probably goes out no more than 6.5 feet, which is where the 6 foot distancing comes from. But if it's a sneeze, it can go even further out, all the way out to even greater than 20 feet. In fact, there's a study from MIT where they claim that droplets in a sneeze can go out to 27 feet. Now, I don't think you need to move to Antarctica to distance yourself, but again, 6 feet is just a recommended minimum. And by the way, exhalation also causes droplets and an aerosol that can go out to 5 feet. Keep your distance. 6 feet is a recommended minimum. Wear a mask when you're outside of your home. Wear any mask. Any mask is better than no mask. Wearing a mask is better than wearing an intubator and a ventilator. Better safe than sorry. Okay, here are some statistics. Total deaths as of a couple of days ago in the world were 88,000. I'm sure that today it's over 90,000. I haven't looked at today's statistics as yet.
Speaker.
And look at that slope
Yes.
going straight up. Then look at coronavirus deaths in the US and look at the date. I don't know if you can see this clearly, but I believe, I can't see it clearly myself, in fact. I think that's February 28th or 29th. And look at the slope, how it goes up. It doesn't look like it's starting to come down, right? Whereas in Italy, that slope has sort of bent a bit, and we'll see a little bit better detail of what's happening in Italy. Now, Italy is important to us because their experience has an earlier date than ours. I think this says February 21st or 22nd. So they are like a week or so ahead of us. And Spain is an experience that's also important because even though they started a little bit later, I think this is what, March the 3rd? I think that they are also starting to see some bending of this curve. And of course, what you want that curve to do is bend all the way down and come down. Now let's see this in another fashion, because to me, it's easier to see the deaths day by day. And look what's happening in Italy. Definite downtrend, definite downtrend. This country, Italy, has gone through a horrible experience. And we have learned from that. And one of the things that we have learned, amongst many, many others, is that this curve does bend down, that the horror comes to an end at some point. And in Spain, something similar is just starting to happen. Hard to say, it's just a slight trend right now, but it looks like it's coming down. So this is also good because we might be following that same direction. However, we're not there yet. Our curve is still going up and up and up.
Yeah.
And remember,
Voicemail, please.
Sorry, I'm hearing someone in the background. Remember that we're such a large country that we do have large pockets, in fact, groups of states towards the middle of this country that are not implementing quarantine, that are not implementing stay at home, that practically the only things they are doing is closing schools and closing certain non-essential businesses. And it makes you wonder if those states will have people and groups of people that will be a reservoir for making this curve continue to go up, even beyond what it should. We'll see how that turns out. But we do have the geography and the population of our country to consider. Now, I'm going to share with you my research of the last 3 months or so. And I've been looking at all of the medical literature in the National Library of Medicine. And here is what I found. You are the first that I'm sharing this information with. So this is my very special gift to you, a compendium of the medical literature on this virus. Prior to December 2019, and that's it. It didn't take me very long to do that research, as you can see, because there's nothing. Or is there? There are some publications coming out of China, like this one that dates back to March 2019. So it puts in question whether or not this epidemic actually started in China in December, late December, as we have been told, because there's a publication about X-ray findings, for heaven's sakes, in positive patients dating back to March. So their experience must have been somewhere in January 2019, or perhaps even in late 2018, to give time to compile the data and make it a publication. Food for thought. Okay, here come the good news. The good news is that we are on our way in the US and elsewhere to produce a vaccine, or more than one vaccine, against this virus. In the US, Moderna is a company that has phase 1 clinical trials underway in Seattle and are already preparing for phase 2 and 3 trials to begin immediately. So this is very good news because this is promising. This may turn out to be a very good vaccine. University of Pittsburgh has one also that appears to be very promising. CanSino Biologics in China is also in phase 1 clinical trials. At the University of Oxford in the UK, they're in phase 1-2 trials with another vaccine. All of these vaccines are different from each other. Right here in San Diego, we have Inovio Pharmaceuticals. They have started this week a phase 1 trial with a vaccine that also looks very promising. And they plan to manufacture 1 million doses this year if everything goes well. So this is our hope. This is what we need. We need a vaccine to prevent further infections, and we can stop this viral epidemic in its tracks. Be informed, not scared, follow recommendations, apply your common sense, be prudent, stay healthy. We will survive. This too will pass. Thank you.